Thank you for joining us. We are here with Dr. Rick Burnett, who is a senior research scientist with Healthy Environments and Consumer Safety Branch of Health Canada. Thanks for joining us here.
Well, thank you very much.
Dr. Burnett, first question. Air quality has improved over the past 40 years in Canada and the U.S., as well as our understanding of its impacts on our health. How have epidemiologic studies contributed to the effective air quality management and improvement in air quality during this time? Do we need to conduct more studies?
Well, epidemiology has been a critical component to our understanding of how our exposure affects our health. Back 40 years ago, the mixture of pollutants in the atmosphere was very different than it is now. And we used to monitor for certain types of pollutants that we thought were most important. But through epidemiology, we began to understand that other types of pollutants were more important. Pollutants that could penetrate deep into your lungs, circulate through your body into your heart. And only through epidemiology and mechanistic studies and animal studies could we actually understand what we should be looking for and how that's going to affect our bodies.
Aside from pollution concentrations, Doctor, what other factors influence the public health burden from air pollution?
Well, there are a number of factors. So where we live determines the kind of pollution, the level of pollution, and the nature of pollutants that we're going to be exposed to. People who are actually socially disadvantaged, even in a country like Canada, are forced to live in areas of higher air pollution. So they have a different they have more exposure and a different exposure profile. People that are commuting to work, for instance, are exposed to more traffic pollution than somebody who's retired and not commuting. So people who are recent immigrants, in Canada we admit very healthy people into Canada. In fact, the immigrants to Canada live about 25 years longer on average than a native-born Canadian. It takes a long time for these people to develop disease. However, they move to Toronto, Vancouver, Montreal, large cities with a lot of pollution. And what we find in our epidemiology studies is that it takes a while for these people to develop disease and to have air pollution affect them. So it depends on your age. Younger people are affected more. Females are affected more than males. People with lower incomes are affected more than people with higher incomes, and immigrants aren't as affected as much as native-born Canadians.
Wow, interesting. I didn't know that. What are the most important findings from recent research on the health effects of air pollution, and how can this knowledge be used by air quality managers to protect public health?
Well, 40 years ago, in fact, when I started working at Health Canada in 1984, the consensus thinking of the Canadian government was that air pollution was somebody else's problem. It was a problem in Los Angeles. It was a problem in London, England. Canada had clean air even back then, and we really didn't understand whether there'd be major public health effects of air pollution. After 40 years of research, a lot of dedicated people working very hard at this problem, the thing we understand now is that air pollution affects us all. It affects us from in utero, so it affects us when we're born. It affects us as children in developing asthma and childhood diseases. It affects us as we go through adulthood and developing heart and lung diseases, diabetes. As we get older, and we know this is a major problem now in many places in the world, of dementia. So incidence of dementia is rapidly increasing in Canada, and now we have brand new evidence to suggest that people who live near high pollution environments like major roads have a higher risk of developing dementia. And then of course there's incidence of cancer. We know obviously about lung cancer, and now we know that you don't live as long if you live in a high pollution environment. In fact, the easiest way to think about the health effects of air pollution is accelerating your age. So if you think that you're 50 years old in a clean environment, you would really be 51 in a pollution environment. It makes you a little bit older, and as you age, you develop more diseases, your arteries harden, your heart doesn't work and pump as well, your brain doesn't work as well, and so you just think about the effects of air pollution is really a total systemic effect on your body. So it's just aging you.
I've never heard anybody say that before.
Well,
That's
that's an easy way to just think about it. It affects your functions of your kidneys and your liver and your heart and how well you can pump blood around your body. It increases your risk of stroke, heart attacks, asthma attacks. It increases the risk of developing infections like pneumonia. So it has a sort of what we call a systemic effect, is all your systems in your body are affected by air pollution, and that just degrades your health, it degrades your defenses, it degrades your ability to fight disease.
Mm-hmm. Okay. What do you think are the most pressing air quality management issues currently and coming in the next 10 years, and what new tools or approaches do you think will be needed to address these issues?
Well, one of the most fascinating things that we discovered over time was that there doesn't appear to be a safe level of pollution, which is very disappointing because we as Canadians think that we live in a very clean environment. Vancouver is very clean. I come from the city of Ottawa, which we think is very clean, but there's still a risk of, when we're exposed to air pollution, and even in these clean environments, there's still an adverse risk on our health. So the first thing that we have to understand is that we can't be satisfied with just having some kind of standard and meeting a standard. We need a philosophy of what we call continuous improvement. So we got clean areas we want to make cleaner. The other thing we don't want to do is, if we have a clean air area and we think, well, maybe we can add some more pollution to that area. Maybe we can have another plant come in or something, because our air is clean anyway. But that means that the air is degraded, our health will be degraded. So we have to be very conscious of the idea that we shouldn't allow pollution to get worse. Now, the other big change that's happening, it's a philosophical change, is for years we had sort of national strategies to improve air quality. So maybe you're too young to remember the acid rain program of the 1980s. But, Ronald Reagan and acid rain. But in those programs, we wanted to reduce a pollutant called sulfur dioxide. And sulfur dioxide mainly came from power plants, coal refineries, big industry. And what we did is we put these things called scrubbers on the smokestacks, which cleaned out and stopped the sulfur dioxide. And then we went to automobiles, and we had new catalytic converters put into an automobile. And you probably don't remember the days, and I do, where cars didn't have catalytic converters. And they were put in, emissions from tailpipe pollutants went way down. And so if you look at, we've had a major success at reducing nitrogen oxides that come out of tailpipes. So sulfur oxides out of smokestacks, nitrogen oxide out of tailpipes have gone way down. What we're looking at now, though, are small sources of pollution. So we're looking at the dry cleaner next door in your neighborhood. We're looking at a small industry, a small refinery, somebody that's making jewelry or something, like that very small different pollution sources. We're going to have to start to target these individual sources, and the science that we have to have is we have to understand what are the health effects of the complex mixture of pollutants that come out of those sources. One source has a certain mixture, another source has a different mixture. Do they have different health effects? What should we do? Should we target one source more aggressively than another source? Treat all sources as the same? Because obviously one of the things that we don't want to do is we need energy to live. We need energy to heat our homes. We need energy to drive our cars and get around. We have to have energy for manufacturing. We absolutely need sources of energy. We can't avoid that. What we want to do is make the air as clean as possible with having the least negative impact on the way we live, on our economy, on our environment, on our lifestyle. So we need better, we need to be, we've been treating air pollution management like with a sledgehammer. Now we need a surgeon's blade. We need to go in and we need to figure out what are those multitude of individual sources that we have to control to get the air quality better.
Fascinating. Yeah. Thank you very much for joining us and talking to us about this, Dr. Burnett.
It's my pleasure. Thank you.